The vaccine developed by the University of Oxford stops 70% of people developing COVID symptoms. And we can speak now to Professor Andrew Pollard, who is director of the Oxford Vaccine Group and chief investigator of the Oxford vaccine trial. A very good morning to you.
Good morning.
This is fantastic news. It's not 95% effective, which your competitors, Pfizer and Moderna, have managed to produce. But as Dr. Hillary says, the flu vaccine is also not 95% effective. So just tell us how important this is.
Well, the first thing to say is we're really delighted by these results. I mean, what we're seeing here is that we have a vaccine which prevented hospitalizations and severe disease in those people who were vaccinated. And we did have a headline figure of 70% protection. That was with 131 cases of COVID that occurred in the trials. But intriguingly, we had a group who had a slightly different dosing regime. And in that group, there was 90% protection against COVID in the trial.
Yeah, was this the group where you gave a half dose followed by a full dose?
That's correct. And because the first dose was a half dose, if we were to go forwards with that regimen, then that potentially means there's a lot more doses to go around. And so we would be in the position where we could get more people vaccinated earlier and start protection to get us towards
the crucial thing, Professor, in terms of your vaccine, is the government, I understand, has already purchased 100 million doses, which, as you say, if we only need a half dose on the first one, will go a lot further than we first thought. It's also, it doesn't have to be stored at sort of minus 80 degrees, like the Pfizer one, for example, and is therefore, I would imagine, much easier logistically to get to a lot of people very fast.
Yes, and I think one really important component for us and in our partnership with AstraZeneca is about distribution. And it's partly about the fact that we can distribute through the normal immunisation cold chain, but also because it's a not-for-profit partnership, which means that it can be distributed everywhere around the world very cheaply in comparison with other approaches that might be taken. But I think here for the UK, all of the vaccines that are available we will need in order to, as quickly as possible, be able to protect people and get us to a point where we can start getting closer to normal.
People will be wondering, well, which one should I go for? What's the simple
presumably
answer?
Whichever one you're offered.
Absolutely. I think all of the vaccines appear to be preventing severe disease and hospitalizations. And for those of us who are over 50, being able to have the reassurance of getting a vaccine as soon as possible so that we can start getting back to normal and not have that risk. The differences in overall protection against milder disease are less important than the ability to stop severe infection. But one of the fascinating things about this subgroup who had the half dose and then the full dose is there's a hint in the data that it may also be reducing asymptomatic infection, and therefore there's less virus around, and we may be able to interrupt transmission of the virus and halt it in its tracks. And we need more data on that, but it's a very exciting observation.
As we sit here heading towards Christmas, it's been a very tough year for everybody. We know this. Everyone wants some hope. You're the one with the brains. You're the scientist leading one of these vaccines. Given all your experience in this field, when do you think, given the way things have gone now with these 3 vaccines now, when do you think we can get back to normality?
Well, I think to respond to the first bit of your question, I feel enormously optimistic. We have the tools with these vaccines, and of course also some of the new treatments coming along, that means that we're at the start of that journey to get back to normal. The key thing now is we don't have any of these licensed. We need the regulators to scrutinise all of the data very carefully and to make sure that we've got everything right and to grant licenses for the different products. And then we've got to get to rollout. The NHS is now incredibly well prepared for rollout. So I'm optimistic that we're going to start moving very rapidly through the first quarter of next year.
Give me a month, Professor. Give me a month to look forward to. Will I be at the Lord's Test match this summer?
I am optimistic that as long as the vaccine is delivered and people get vaccinated, that we can start to get back to normal during next year. I can't give you a month because a lot of those next steps are out of my hands.
Professor Pollard, two questions from me. When will yours be available? And secondly, what threshold of people do we need to be vaccinated to have that sort of immunity society-wide that is going to enable that normality?
Well, I think that in terms of timing of when the vaccine's available, there are already vaccine doses that are sitting there. What has to happen now is the data that we've assembled from the trials needs to be put together by AstraZeneca to submit to the regulators. And then they need to look at that and look at it carefully and decide whether it should be approved. So once that has happened, then there are doses of vaccine sitting there that are ready to go.
Brilliant news.
And just on the threshold question, how many people need to be vaccinated?
Yeah, sorry about that. I think as far as the threshold is concerned, we don't know at this moment. The key thing is that people who are vulnerable in the population must be vaccinated, because the one thing we do know about all of the vaccines is that they are able to protect against COVID-19. So, but if you're not vaccinated, you're not protected. So we've got to get it rolled out and get as many people protected as possible.
I got a note while you were talking from a chap I know called Andy Wigmore. Morning, Piers. As you may remember, I told you way back I'm one of the lab rats on the Oxford vaccine. The people behind this are just brilliant. Every single one of them, the nurses, researchers who've come from every corner of the world to literally save us, are part of this incredible team. Please thank them. The Oxford vaccine's a game changer and will be available to everyone. The entire country should be thankful for these people. I could not endorse those words more. I think everyone who put themselves forward as a lab rat or one of the researchers or one of the nurses or the professors or the doctors, really, as a nation, we're in your debt, all of you.
Well, I think we have the most incredible team of people who have been working tirelessly all this year, since January, to try to get to this point. And across England, Wales and Scotland, we've had 19 trial sites with many thousands of staff now involved in the trials, and our wonderful collaborators in Brazil and South Africa. So there's all of the research teams, but we also have this huge gratitude to people who've brought themselves forward to try and help with this effort. And of course, remember when we started this, we had no idea about whether these vaccines would work or they're safe. And so it really is absolutely dependent on the goodwill and the huge confidence that the public have to come forward and take part in research, which is critical. And of course, NIHR, who funded all of this work in the UK.
Just want to bring in Dr. Hilary Jones, our top doc here. Doc?
Yeah, Professor Pollard, I just have to endorse everything that you've just said. And I think everyone needs to be reminded that 75 years ago at Oxford University, penicillin was developed and given out to the troops and made a huge difference, not just to the Second World War, but to everybody since. So well done again.
Yeah, a brilliant, brilliant work by our scientists. Professor Pollard, thank you so much for joining us and well done.
Thank you to all your team.
Congratulations to everyone. Good news.
Thank you.